I'm Professor Jun Marley and I'm the Medical Director of the Mood Disorders Unit at Ramsay Clinic. And today I'm going to be talking to you about bipolar disorders. From a clinical perspective, I manage patients who have already been diagnosed with depression or bipolar disorder. And that's somewhat frustrating in the sense that I always feel we're playing catch-up. We're trying to manage an illness that's already existing. And so my research interest is actually in terms of trying to prevent the illness ever emerging and preventing the earliest signs or treating it at the earliest point in time that you can reasonably make a diagnosis of depression or bipolar disorder. And that's what I've been working on over the past 5 to 7 years with support from the NHMRC for neuroimaging research in adolescents. And the idea really came about because we see that depression and bipolar disorder do start around this time, possibly post-puberty. These earliest signs and symptoms emerge. And so we've been tracking students in school at different time points to see whether there are brain changes that can give us an indication of those that are most likely to develop depression or bipolar disorder later on in life. And earlier on, it's really anxiety and emotional symptoms that they manifest. And already we've published a paper a few years ago which identified changes in the hippocampus, for instance, a key part of the brain that lays down your memories, that seems to be compromised very early on, even prior to there being clinical symptoms, but correlated with emotional symptoms. And so that's the type of marker we're looking for, where we can identify changes very early on, perhaps even as young as 13, 14, which give us an indication that this person may be more vulnerable than most. So you might ask, well, what would the benefit of that be? Well, first of all, we'd be able to pick up the illness much earlier. Secondly, if we had treatments that were effective, psychological treatments, say, then those could be instituted to those vulnerable people at that time, saving the possibility of them ever developing the illness. So there are important differences between the presentation of mood disorders in adolescents, say, and adults. The adolescent brain simply hasn't developed fully, and the person is still learning about the world around them. So the way they formulate their ideas, the way they express their ideas are necessarily different, and we need to be mindful of that. Hence why I think the threshold for diagnosing depression or bipolar disorder needs to be much, much higher. That's not to say that our vigilance shouldn't be greater. And the types of things we're looking for are sustained changes, not transient changes which last, say, a day or two. So they'll be very similar in terms of the mood symptoms, the energy symptoms, the sleep symptoms, but it's matter of fact in terms of the longer term change. Is this impacting their attendance at school? Is it impacting their social network? Are they disengaging from those around them? Have they had some personality change that the parents can identify that's being lasting for, let's say, weeks and months? Those are the types of concerns. On top of that, there are obviously signal events. If the person threatens to harm themselves or is even considering harming themselves, those are things that need to be taken seriously, assessed properly. And I would really urge parents to talk to the child or adolescent and get them to see a professional earlier rather than later. The biggest problem I see is that people sit on the problem for far too long before engaging a health professional, and there's no harm in getting that opinion. Having said that, I think treatment, however, should be only prescribed once the diagnosis is absolutely clear, and once it is clear that there's a problem that's going to be helped with that particular treatment. So there's a twofold problem, that of detection, and the second problem being that of treatment. And I think they need to be dealt with separately. But there's certainly no harm in seeing a health professional very early on.